Another representative of an awarded museum, Hans Looijen, director of the Museum van der Gast, the Museum of the Mind in the Netherlands, will join us online to discuss culture and health, museums' responsibilities towards society, impact, new public, new partners, new power. Hans.
Yes, us. Hello, my name is Hans Looijen, and thank you for the introduction, director of the Museum of the Mind, with 2 locations. And you can see here, we are fascinated by the artwork between your ears. As a pun, I sometimes say we have 8 billion objects walking around in the world, and we are not collecting them all, but we're very interested in you. We are an independent museum. That means we don't get any government funding. We are supported by a growing number of mental health care institutions and organizations for people with learning disabilities. And we are a middle-large museum for the Netherlands. We have about 200,000 visitors a year. And by the way, I'm a museologist by training. So I'm like a fish in the water here. Yes. Oh, let me see. Yeah. I think in Greek it says Singharitiria. Congratulations. A Just Cause is coming to a close. I wanted to show this. I should have been in Athens now. I'm so sorry I couldn't make it in the last moment. Something came up. And we are all aware of the importance of our identity and defining ourselves and our awareness of ourselves. After all, psyche is a Greek word, I suppose. I don't speak Greek. And I think it means soul or essence. And it was a beauty, no less. But what if it's lost? What happens if you or someone else is no longer putting any trust in your mind? I know from firsthand what that could lead to. My mother was a patient. She's now deceased. And she decided to keep secrets about her condition for us children. I have 1 brother and 2 sisters. So this was a big secret in the house. And that did not work, I can tell you from experience. And likewise, it does not work to keep a story lingering on, even if it's for 200 years. That doesn't add up. But I want to congratulate you on the Parthenon statues almost coming home. Let me get to grasp with my presentation. Yes, we won the award. It was just mentioned, so we're very proud. And we completely renovated our museum building, which is a national monument, which first opened in 2005. And it's located in Haarlem, the original one. There's another one, which is now part of New York. And it's close to Amsterdam in the metropolitan area of Amsterdam. So we did a careful restoration. Well, you can all imagine that. But most important, what I want to show you is that there was a wall all surrounding this building, because it's the architecture of exclusion. This hall in the middle was especially built for people suffering from leprosy. And this is around 1400. And so they were expelled from the city and had to live here and be cared for. Here's see another close-up. So we opened up the wall and created an entrance for the people to come in. And part of this is a chapel, which was used until the Reformation, when the Netherlands became reformed. It's no longer Catholic. And this is a history of over 700 years. The first mention is 1319. Yes, the artwork between your ears. And I think really this is what I really believe in, should, as museums, add to the agenda of society. We have a social responsibility, is my deep conviction, to not only contribute to the agenda, but also setting agenda issues. The other day I was asked to join in a discussion for the museum, this museum association in the Netherlands, and there was an item on sponsoring. And there's a question on sponsoring from an oil company in the Netherlands to support a new building. And I'm strongly against that. So I think in sustainability issues, we have a responsibility too. So we should care not only for the collections which are entrusted to us, but for society at large. Yes, that's my deep conviction. And this can lead to a more inclusive society, as is stated here. Yeah. But for us, most important is putting mental health on the agenda and also fight stigma in psychiatry, because there's a lot of prejudices inside the care system as well. Yeah. So the key message of the museum is it's a museum about yourself. So we wanted to set up the museum in such a way that people would exit the building and think, that was about me. It's not about someone else. So mental health is something we all experience, or the lack of it. 1 in 4 people, so it's 25% in the Dutch population, will be treated within mental health care in his or her life. So that's a lot. And it's not only in the Netherlands, it's in many countries which has been investigated. So it's something which is there, and like the former speaker, which is not addressed. And that's where we come in as a museum. But the real work has to be done outside our museum. The 200,000 people, we are grateful for them, that they want to spend their time with us in one of our locations, but we don't want them to leave it there. Yeah. So you have an overall impression of some of the rooms in the museum. And why do I show you this? Because we set up the new museum in the same way as people receive care. So it's like a stone in the pond. It starts with me. I'm not feeling well, maybe. And it takes a while before you see a doctor, a psychologist, or even maybe a psychiatrist. It starts with me not being well, or maybe I don't notice someone else. You might say, what's going on? I might say, I need a rest, I need a vacation, and so on. But it goes on. Then maybe it's a secret, like a family secret, but then it shows at work. So someone else gets involved, and so on and so on. So we set up the museum like, what is my mind? And who am I? And so on. And we have these questions on the wall. The white one on the right hand is, in Dutch it says, what is your mind? And one of the other questions is, who do you see? So you go from, what's my mind? Am I my mind? Who do I hold dear? Who takes care of your mind? To who do you see? If you look at someone else, you see this bicycle. This was for someone living on the streets. So is this someone creating problems in the streets because of his behavior? It was a man. Or is this a survival artist? So it depends on the way you look at it. And yes, the finger's pointing at you, that's stigma, of course. And we connect it by threads to pieces of the collections we have. And underlying this principle, which is very important, I don't know if many of you work with this principle or have heard of it, is the positive health. It's all about me, because we live in an individual time now, and this is how we use this to get to the public. One of the things very striking, someone told me once, said, with the inventor of this system, a doctor in the Netherlands, said, we have problems with people who keep coming back to healthcare system, the somatic healthcare system. For example, they experience a painful knee, and they say, wow, I have problems walking, I can't move about, and I need to be examined. Can you give me something to cure my knee? And then the doctor checks on the knee. Is it bending? It's no infection, nothing wrong mechanically. And then it might be that on one of the other axes, something is not right. So the bodily function might be all right, might be in order, like something to expect it at your age or your phase of life or the work you've been doing, or etc. But then you have the other things, like, is there a social connection? How's the quality of life? How's the level of participation? What are daily activities? And many, many, many times it's that on one of these other axes, things are not adding up, like in the beginning. And mental well-being, which is broader than mental health, is something which, as part of this vijfhoek, so this figure should be taken into account by all doctors. So this is now promoted within the healthcare system in the Netherlands. Not necessarily mental health care system, but family doctors. We have family doctors. Before you go to a hospital, you go to your family doctor, and they refer you to a hospital. But they are investigating, is there something we can do on the other axis? Yeah, so the case for renewal for our museum is, there should be text coming now. The case for renewal for the museum is threefold. We have three pillars. We have the care of the mind. How was it done? In the 700 years of the building history. Let me see if this... here we are. Yeah. And I strongly believe that the care of the mind should equal the somatic care in the Netherlands in every aspect. This is not the case at the moment. I think for many of you in your home country, it might be recognizable. Mental health care is kind of, the stepchild. It's not treated, there's not as much money, there's not as much institutions. It's something we shun away from, and it's a stigma and it's a burden. It's something you won't have. We need an emancipation, like the cancer history of the fighting cancer and researching cancer, or the rights, the women's rights, or the rights for people of color, or the equal rights movement and LGBTQI. That's something we need for mental health care as well. And another striking thing is that, in my opinion, we're still at the moment that healthcare is repair. So we do something after things go wrong, especially if it's about mental health. Okay, there's another topic I'm going to talk tomorrow about in the masterclass. I promise you it will be completely different than today, so don't worry. And a new term, maybe for you, you know it already, neurodiversity. So we don't talk about all the labels, we talk about neurodiversity. Yes, what is neurodiversity? We can read it here. So we come from the position that all differences are part of humanity, and is not a deviation, which is always what has been said. So neurodiverse people experience, interact, and interpret the world in a different way. And this speaks for itself almost, that we include all groups, multi-focused, multi-voiced, and learning and reading accessibility is very important for us. But also I like to stress is that we don't put any labels, we don't talk about illnesses, we don't use any language that people we bring forward by choosing use themselves. So people speak out for themselves, it's not us. It's their podium, it's their floor. We are just there to show it. One of the tricks, if I may share with you, is to fit in the lives of our audiences. We struggle with the fact that we are open during office hours. Why? So you leave your street where the museum is in, and you say, okay, bye. And that's the moment we turn on the lights. And after 5, you think, okay, I'm going home now. And the museum is closing at 6. So this is strange. So, and this is only opening hours. So also in our stories, we try to fit in the life of our audiences, which you can see here, created a special tools for everyone. And very important, we have a cafe, which is in a nice park. It's open for free. Everybody can come in. There's a playground next to it. And the people come in the weekends, have their cappuccino lattes and whatever, and the children play. And they go and use the toilets in the museum, and they see and experience everything in full out in the open. Yeah. This is, as a museologist and a son of a teacher, something I cling to. I think this is something we use in a museum. So the unfreezing of the public first, then moving them, feeding them with new information, giving them new insights, and then trying to consolidate that principle. So you can have just coffee, lunch in the cafe. I talked about it, and enter the museum and choose one of the tours which are there. The unfreezing is this installation, the resonance room by the artist Nick Verstand. And you come in and it measures your bio data. There's a clip on your ear. So respiration, blood pressure, several other things. And the less you do, the more active this installation becomes. So it's kind of an incubation in between the outside world and the world you're about to enter. And so we say to people, relax. It's only a museum. Nothing scary about it. This is one of the moving things. To this as an example of the opening performed by Queen Maxima. So to the left, this gentleman is Ahmed Turkman, and this is his stigma jacket. This is a piece of garment he made, and he literally wore when he went out to schools with this pink elephant, which is an inflatable elephant, under his arm. He entered the classroom and said, yes, this is a pink elephant, and this is the pink elephant I'm wearing, the stigma, because in my community, in my life, nobody was talking about the problems I was experiencing. Because there's problems, I became addicted. But my family, no one talked about it. And I felt the stigma. And I felt people saying, you're a loser, you're not worthy, you're untrustworthy, you can't have a job, you not to be trusted with money. All these things, these labels he put on the outside. And on the inside, he put his labels saying, I'm also a father, I'm also a son, I'm also a friend. And as for the former speaker, the number of people with psychological problems is staggering. And the impact on life, education, training, study or work is very evident, of course, and social inclusion increases the suffering. So mental health care can do something the museum cannot. That is actually provide care. And the museum, that's where we are, can do something mental health care cannot. We can make a mental health care negotiable and familiar to a large new audience in a different way. And I'm very happy the Queen wanted to open the museum, reopen it. She speaks out more and more in favor of mental health. And she has a sister which took her own life, and she has been open about it. So this is very important. I also take a very activist position, and this is the freezing bit. So this has been translated in English for us today. This is the Universal Declaration of the Open Mind, which we created together with experienced people, with healthcare professionals, people in the healthcare system, and social rights activists. So it becomes more rigid the more down you get. There's obvious things, but I think it's very important we promote this, that we put this agenda forward and ask people to live by these conducts, so to speak, outside the museum. And so we ask you to sign this declaration, and then you can lift it up. The Queen is doing that, and it will become part of this huge installation, which now once a month we have to take everything down because the weight of all the declarations being signed. So this is good. And I'm pondering at one stage that we can collect all these signatures and and give them to a minister, to the politicians, to say, we need more attention for mental health care, and we need a system which equals the somatic healthcare system. So the museum setup, I was already talking about it, for 3 pillars. And yeah, we have collection. Here you see some of it. We have an image collection. It's also very special. We don't have this painting anymore. It's now in the Frans Hals Museum, the art museum, 17th century. This was a system of healthcare by important citizens, men and women, who administered care institution, Caritas. And these were the ladies administrating the asylum, which was one of the functions of the building at some stage. But anyway, so we have as a pillar care of the mind, 700 years, how it's been done in the Netherlands, and also how it was present, is present in all the cultures you nowadays find in the Netherlands. So we have a cross-section in time and cultures. The second is thinking about the mind. Where is it located? Why doesn't it malfunction? What are the cures, maybe? So we're not prone to the Western medical model. We use a social model also in here. So we have beliefs, people, explanations, thinkers, spoken word artists, etc. And this statue is from Winti, which is an African Suriname religion, which was constructed, if I may say so, in Suriname among people who were enslaved, lived in slavery, and came from the western parts of Africa and kind of merged the religion into a new system. And this is still used, this religion, for people who experience mental health problems, to ask gods to intervene or to ask for a cure. So this is an original statue in the museum, which was inaugurated by a Winti priestess, for example. But thinking about the mind. Yeah. And the third is imagination of the mind, everything which is not there, but is created by us. Yes, art. Yes, literature. Yes, poetry, etc., spoken word. And here you see outsider art. I'll come back to that later. As said, there's about 2 million people in the Netherlands. We have 17 million now, which have problems reading and writing. It doesn't say they're analphabetic, but they will experience problems receiving a letter from the government, for example, or from their landlord. Understanding more complex texts is difficult for them. So we use hardly any text in the museum. We have a guide, and you can choose a route. We have many routes. You can, on this through the building, open mind tour, which you see in the middle, or a young adults tour, or children's tour, or arts tour. And this guides you through the museum. And you have spoken words, you have audio track, you have imagery, you have small clips, you can react to it. I think that's a very important part of our strategy, to not put text on the wall and make people read them. And so all the level of the information is on B1, which is for the Netherlands, for people to understand, also if they have reading or writing difficulties. Let me see, where are we? Yeah. And yes, we have art. We have a lot of arts. We have Tracy Emin, Fantastic to Feel Beautiful Again, Mark Quinn, Emotional Detox, and we have outsider art. And the role of art is to convey something which is sometimes hard to grasp in words, and to move and to make you stand still and be inspired, of course. And that's great art. And while we encountered artists who travel the world, a couple, and who go into streets and ask people, "Hi, how are you? What do you think important? What is your life experience?" In 3 sentences, all over the world, people are talking about their minds, about how they are, where they are, problems they experienced, like the last speaker. So people are opening up, but we, as museums, also have to facilitate that conversation. Yeah, I was already mentioning outsider art. I think it's very important to emphasize our role in broadening the cultural canon with outsider art, which is art which is not part of the curriculum usually. It pops up more and more, and we see mixes now and then. But in the Netherlands, there was nothing until we opened in 2016. We also engaged the Queen. We were very thankful that she wanted to open this museum in the heart of the Dutch cultural offer museums, and we're at the Hermitage building. You might know it as art brut, singular art, as all these names. Now, outsider art is a term. It's also being questioned, but I like to emphasize it's the art which is outside. It's placed outside the canon, and it's not about the artists.
Hans, I'm
Yes.
sorry to interrupt, Hans, but we're running out of time, quite over 10 minutes, so I will have to interrupt you. I don't know if there's something you would like to conclude with, and I'm sure tomorrow we'll have the opportunity to listen to you in more detail during the masterclass.
Yeah, sure. I think in general that an important thing is, we can do this tomorrow. That mental health care is very important. We all have seen it during the pandemic and the corona crisis. In the Netherlands, there's a lot of young people experience problems now. This is something we can do tomorrow. But the last thing I like to tell you is that we have an extensive reintegration program. We work with a lot of volunteers, and you find experienced people on all levels of the museum, from working at the counter, greeting you, working in the cafe, working in the reception, working in administration, giving guides, there are tour guides in the museum, and we have a program in which we offer work experience places, and we have placed dozens of people in paid jobs outside the museum. And this is a social responsibility which I hold dear as well, very much. Yeah. So you can have all read it, and we're very proud of it. And tomorrow I hope to be able to talk to you again. I promise you. We can go into depth further on lots of things, and I hope to see you then. Thank you.
Thank you very much, Hans.